Hello parents, this is Dana. I'm going to talk about Applied Behaviour Analysis, ABA, a little more in detail today. As always mentioned, I'm always talking about ABA, Applied Behaviour Analysis, because this is an intervention that is proven with lots of studies on it to have helped modify behaviour of kids on the spectrum. And it is also an important intervention in early childhood. And personally, my take is, without a calm temperament, it is difficult for a child to absorb and learn properly in any kind of environment. We have to tackle the root of the issue before we keep trying to make our child learn. Now, behavior and temper tantrums control needs to be regulated before we can even implement any forms of teaching and learning. And from my experience, ABA is one of the best intervention to deal with behavior regulation and control. ABA has a long history and it has come a long way with some evolution as well. I think decades ago, some parents might resist ABA as they feel that their child starts behaving too robotic and might be speaking in an unnatural tone and uncontrollable loudness of their voice as well when they verbalize. However, most ABA therapists now practices verbal behavior, which is more flexible and helps kids to generalize their skill better in different forms of learning settings. And ABA is also a proven method. Now, studies and cases have been done to show that doing intensive hours of ABA will help modify the child's behavior and positively to an extent. Now, some reflect faster while some kids might react and take a little longer, just like all individuals learn differently. As I mentioned in my earlier video, follow-up program at home for ABA is also very important for a more speedy, faster progress and better generalization skill for the child as well. Because as mentioned, all adults implement differently. So it would be helpful to rotate the therapies and not just use one therapist to strengthen generalization skill of the child, since all individuals implement instructions and questioning differently. The main caretaker could be mom or helper or grandparents of the child should try to understand the main targets that the ABA team are trying to work on and follow up on it consistently and try to help generalize the learned skill in a more natural setting. For example, home setting, or even when we are going out in a different public setting, the child is able to implement the same skill learned. A positive mindset leads to a positive future. This is Dana from danalink.com. Remember to subscribe to my channel and press the subscription bell to get the latest video.